Hey everyone, what's up? This is Dr. Charlie, PT. Hope you are doing well. And I don't know who needs to hear this today. Maybe it's me who just needs to hear it, but maybe it's you who needs to hear it. In today's video, I want to talk about pain as a preoccupier. So we're just so biologically wired to believe that all pain that we feel is physical. Sometimes it is, and we can help you with that. Sometimes it isn't. And this was actually sort of inspired by a conversation I had with a woman yesterday, who I was working with, who have been dealing with sort of the piriformis type pain in her butt and sort of pain in her hip for quite some time. And she had gone down the rabbit hole trying lots of different treatments, only to find that they didn't work, physical treatments that is. And one thing I noticed just in the initial conversation with her is how amped up she was. You could see she was stressed out. I think she was a couple minutes late for the meeting because she had to cancel another meeting to get to this meeting, right? You could tell she had 1,000,001 things going on in her brain, in her mind, right? She had a lot of commitments, very type A, get her done, people pleaser type sort of personality, right, if you will. And the conversation for her, she thought was going to be about resolving the pain in her butt, and sort of, I guess, in an indirect way it was, but it wasn't. It became about something bigger. It became about how so many times when we're in pain, we focus just on that as an isolated problem. But it could be the symptom of something else. It could be a symptom of preoccupation, of hypervigilance, of constantly living in a state of fight or flight. And so instead of talking about specific exercises this woman could do, instead of talking about the way she sits or the way she moves her body, she told me a couple things that cued me into the fact that her mental state, if you will, her psychological state, was just full and overflowing, and not in a good way. And that her symptoms were of probably more the mind than the body. So what she told me, she said, Charlie, it's crazy. I have this pain in my butt, but the other day I was at work, I was all stressed out. Things are busier than ever. Usually Friday's a really calm day, but this Friday was different. I was just slammed at work, and I had other pains because I'm doing all this physical stuff. I had pains in my shoulders and pain in my neck and pain in my mid-back, and it was crazy because the pain in my hip went away. The pain in my butt went away. And I said, isn't that interesting? And she said, what do you mean? I said, well, do you think that your hip, do you think that your piriformis just got better when all your other pains started to occur? And then what happens is when all of her other pains, her shoulder pain, her neck pain, her mid-back pain goes away, her butt pain comes back. And then when her neck pain and her shoulder pain comes back, her butt pain goes away, right? And so you can see it, that doesn't make structural sense, right? There was something wrong there structurally. It doesn't do that. It doesn't flip-flop like that. Instead, what's happening is, if you're watching this and you have symptoms that sort of jump around, or you notice the same thing as this woman, which was, again, that she often has other pains in the body or other things that happen. Could be life events even. And when those things happen, when pain pops up elsewhere, when you go on vacation, when you have something bad happen at work or good happen in life, that your symptoms might vary according to those situations. In this case, another pain came on, right? And then her primary pain that she contacted me for, the pain in her butt, went away. And then again, when that pain resolved in her neck and her shoulders and her mid-back, her butt pain returned. And so the conversation I had with her was around preoccupation. And pain is a great preoccupier. It's a great protector, if you will. It's designed to protect you from some perceived or actual threat or danger. In this case, perceived. And where was the danger? The danger was in her mind, right? Her brain firing off danger signals because she's constantly stuck in a state of preoccupation or fight or flight for whatever reason. Probably even since childhood, she admits. And this shows up in many areas of her life. So if she's habitually preoccupied and constantly searching to solve a problem and to figure something out and to get something done, because there's always something that could get done, right? Then guess what happens? If pain is a great protector, right, it focuses on the greatest threat to the system, When her neck and her shoulders and her mid-back hurts, forget about the hip. We've got to focus on this thing up here. And then when that goes away, now we've got to focus on the hip. And oftentimes, especially in this very busy world and busy life, there's a lot going on, right? We can get sort of addicted to this state of always being on, being hypervigilant, searching for problems. And well, a problem's only a problem if you make it a problem, right? And that's what this woman got stuck in a state of. She was constantly scanning her environment for threats. Right? And she was so used to it. It was so habitual for her that even if we did focus on getting her hip pain to go away because it was a problem in her hip, she would find something else. When her neck and her shoulders weren't painful, she would find a problem in her hip. When the problem in her hip was no longer there, she'd find a pain somewhere else. When she had no pain, she mentioned this in the call, she'd discover ants crawling on her countertop. When the ants weren't crawling on her countertop, there would be a problem with her car. When there wasn't a problem with her car, there would be a fire at work, and so on and so forth. Do you see what I mean? And so are we just jumping from one problem to the next? Is the pain that we're experiencing due to a physical problem in the body? Maybe. But does what I'm saying resonate a little bit with you? In which case, we took the approach of treating her pain as more of a preoccupation, hypervigilance, fight or flight issue, just in general, to best care for her as a person. Someone who you can tell is stressed out and constantly in a state of dis-ease. And we asked ourselves, sure, we could put on our goggles and we could focus on just treating this hip. But this woman's more than a hip, right? You can see that she tends to jump from one problem to the next. And if pain is a danger signal, and if pain is a great protector, right, then it's very possible, and you can even see based off what she said, that this constant state of feeling threat, feeling in danger, psychologically, is the likely contributor to her symptoms. So what do we do? All right? So if that's you, if symptoms are bouncing around, if you feel like you just can't catch a break, you might be trained to be in problem-solving mode. And the more you try to solve a problem, the bigger the problem becomes often. Because again, a problem's only a problem if we make it a problem. And maybe one nugget that I think she found useful is this idea of like, look, most people feel as though when they get out of pain, when they remove their pain, that's when they'll feel good. I'll be happy if I could just get this to go away, I'll feel good. But it's actually quite the opposite for many people, all right? Especially those who are sort of in this fight or flight state. And you'll know it. If you're watching this video, you'll know if you're somebody who's in this constant fight or flight state. You'll just feel it. You might even give off that vibe. People might even tell you, why are you so stressed out? So instead of the pain going away and then you feeling good, what I found is that when you get good at feeling good, that's when the pain goes away. So again, we treated this as a preoccupation problem. We zoomed out and said, hey, you're more than just your hip. We've got to really help you resolve this bigger picture more long term, because I'd be doing you a disservice, and you might be doing yourself, if you're watching this, a disservice if you just treat one pain problem, because the habitual addiction to being preoccupied and trying to solve a problem and look for things, scan for threats in your environment, will just cause it to pop up in some other way, shape, or form. Okay, so what do we do? So we started to look for ways that we could take her from a place of dis-ease and put her more at ease. Now, this is not an overnight fix, and this is not simple. It takes repetition, it takes practice, it takes conscious practice to start with. So you can teach your subconscious emotional mind that it's safe. And it doesn't always have to be scanning the desert looking for lions. Is that where lions live? In the desert? I don't know. So what we did is we said, okay, what are some areas of your life where we could put you more at ease? And so I asked her one important question. This may be something you want to ask yourself. I said, this week, how many things did you do that put you in a state of joy? How many things did you do just because you wanted to? She said, well, actually this week it was really busy at work. So I usually get up in the morning and I drink my coffee. I do some word puzzles, something like that. I take my dog for a walk. I feed him treats, all that good stuff. But this week I dropped that. So isn't it interesting? The first thing you drop is self-care, self-compassion. Again, what you could sense is if you picture the mind, if you will, right? Your psychological threshold is sort of this bucket of water, or whatever you want to be in the bucket. Right? So many times, you could tell this woman was having this struggle, and maybe you are too, is the bucket is filling up with water, right? And if we don't want the bucket to overflow, we have to take some time to care for ourselves, right? We've got to take some time to dump it out or get a new bucket, right? But how many times, and this woman did it often, I do it sometimes, you probably do it as well, do we just disregard our own internal state, this internal bucket, and we just allow it to overflow? And it's overflowing, and we're just ignoring it. There's a flood happening in our mind, and we're just ignoring it. Right? If there was a baby in the other room, and it was whining, you'd probably go check on it at some point, right? There's almost a car accident. A state of fight or flight right here. And some choice words. I'm just making sure everybody's okay. I may pause the video for a second. We'll see what happens with that. Okay? Maybe they want to consider this. Okay? That if there's a baby crying in the other room, you go check on it, right? But if your own internal baby, so to speak, is crying, if that bucket is overflowing, do you check on it, or do you just let it keep crying? Do you ignore it? You do, or you might, right? An example might be, and I do this often, you wake up and instead of, just like this woman did, instead of attending to your internal state, instead of taking some time to do a morning routine or something you enjoy to do first thing in the morning to make sure you've eaten well, that you wake up on the right side of the bed, right? That you feel productive to start the day, you might say, screw it, I've got to get to the office. I've got to get to work. I've got to start responding to messages. You might wake up and check your email right away, or your text messages, or your social media, right? And the grind starts. But that puts us in a state of problem solving, puts us in a state of fight or flight. And so again, this woman was ignoring that internal bucket. It was overflowing. And that overflow, if you will, was causing such distress and such disease that it was causing pains and problems all over her life, or all throughout her life, right, in various aspects. And so I challenge you is, how could you become more at ease? Some practical things. Look at your daily workflow. When you wake up, what do? Do you put your own mask on first so you can put others on, so you can help others? Right? A lot of times the way we see it is like, well, hey, I've got to get right to work. Hey, I've got to do these things. I've got to take care of other people. Very common with folks who are getting stuck in pain. It's this sort of people pleaser, get her done attitude. Me last, everyone else first. Oftentimes people feel bad taking care of themselves, right? When I challenge you to realize if you don't take care of yourself, you can't take care of anyone else. Now, I know this sounds obvious, right? But easier said than done to apply, okay? And so look at your daily routine. When you wake up, what do? Do you ignore the flood in your own mind? Do you ignore the crying baby, right? And just get into things, just get at it? Or do you take the time to go to the gym? Do you drink a cup of water or a cup of coffee? To sit outside and listen to the birds? To do something you want to do to kick the day off the way that you want it to begin? That's one thing. You can look at sort of your daily workflow. How do you set that up? First things first. At work, what does that look like? Could you batch email collection to where you only check it once or twice a day instead of every 5 seconds. Ding, 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 ding. Fight or flight. Got to respond. Got to get on it. Right? Could you set boundaries? This is something we chatted with her about. Could you set boundaries at work? Or ask for some assistance if you feel like you're overloaded? Maybe, maybe not. Is there any way you could change where you work or the environment in which you work? Not necessarily suggesting you get a new job, but maybe. Or maybe you're able to work from home some days, or maybe you're not. Right? And again, we're just starting to, and my challenge for you is to come up with some solutions, workflow-wise, right? For how your day looks and how you could make it happen from less of a place of fight or flight and force. All right? So we've got workflow. The next thing that we have is, so we remove some of these fight or flight triggers. We try to optimize the workflow of our day. We sprinkle in some self-compassion, self-care activities, but we could also sprinkle in some glimmers of joy. So again, answer the question, what's one thing you've done in the past week that's brought you joy? And this woman said, actually, tomorrow I'm going to have a massage. I said, great. That doesn't have to be a massage. It doesn't have to be you get your hair cut or your nails done or whatever. It could be you just like allow yourself to go for a walk at lunch. It could be that instead of pushing through, I meant to say this earlier, instead of pushing through hunger, I do this in the morning, right? Just got to get right to work. You don't eat breakfast maybe. Maybe you don't even allow yourself 10 minutes to eat lunch. Or you're like chowing down as you're on the phone, making calls, responding to emails, working, right? Instead of just taking a moment to go for a walk, to allow yourself to just sort of check in and say, hey, how am I feeling? Is my bucket full? Does it need to be emptied or not? I ignore my hunger. I ignore my thirst. I'll get to that later. I did this yesterday. I worked all through work. And my chicken sandwich is sitting right over there, stone cold by the time I got to eat it. Makes me angry, right? And then I get upset with myself, like, I shouldn't have done that, right? Then you get upset at yourself, you shouldn't have done that, you know you shouldn't have done it, right? And then this habitual negative feedback loop starts. And so maybe you do little things like that. You got to go to the bathroom, but you hold it because you don't want to look weird, right? Walking out of the meeting. You skip lunch. You don't drink water. You don't go for walks. You don't take a moment to just listen to the birds chirping or the people honking their horns, whichever you prefer, right? And so I challenge you to sprinkle in some joy throughout the week and ideally throughout the day. Maybe first thing when you get up, maybe something at lunch. It doesn't have to be much at all. It could just be, again, it could be something simple that you enjoy. This woman yesterday was going to cancel her plans she had been waiting for weeks to go out to dinner with her friend because she has too much to do. How many people have said that before? I just got too much to do. There's too much going on. Keep it. Keep it. All right. And so we subtract or we optimize the healing environment psychologically by tuning in and giving ourselves a chance to attend to our internal state, clearing out the bucket, dumping the bucket as needed. And we do that by, again, optimizing maybe how we work, what we do first thing in the morning, how our work day looks to put us in a place of more ease versus dis-ease. We sprinkle some self-compassion and moments of allowing ourselves to do those things. And then we toss in some joy throughout the day and throughout the week to put us at more of a state of ease. Right? We know what we have to do often. We just don't give ourselves permission to do it. So this is me giving you, if you needed it, permission to do it, or a little bit of a fist bump to say, hey, you can do it, and it's okay. All right, so hopefully this was useful. A little bit of a different video today, but just wanted to have a chat with you all after this really empowering or powerful conversation I had with this woman the other day who's been stuck in pain for a really long time, and she just feels like nothing's working, and she can tell she's just fighting so hard in so many different areas of her life. And it became less about pain and more about preoccupation, because again, pain is a danger signal. It's a great protector. It's a great preoccupier. When we're in pain, we tend to focus on it. It gives us something to work on fixing. And if we're stuck in this fixing mode, what happens is one pain goes away, another one pops up. If it's not a pain, it's some other problem in our life. So something to consider if you're feeling stuck in pain, you're feeling frustrated, zoom out, look at yourself, bigger picture than that, and really think long term. What is something you could do to live in more of a state of ease versus dis-ease? This was helpful, and you're looking for someone who can sort of think outside the box and not just see you as a hip problem or as a piriformis problem or a disc problem. We can do that if we need, right? But somebody who's able to sort of tune in and really pick up on some of these things. And maybe you've watched this and you said, hey, this is different. This is interesting, right? I know I'm a physical therapist, maybe not a psychologist, right? But when you're dealing with people in pain, you have to understand that it's both a mind and body feedback loop. And we must consider both in the treatment long term. Okay, so this is Dr. Charlie again. If you're interested in some help, go ahead, click the link below. We work with people all around the world. First step is we would actually have you set up a time to chat and review what I call a formal case review. So you would click the link below in the comments or the description, take you to a place where you can set up a time to chat, and we would actually have you submit details of your specific case. I would review it personally. If I don't feel I can help, I'll just let you know. If I do, we can talk about what that looks like, okay? Thanks so much. Again, this is Dr. Charlie. If you have some type of back, butt, or sciatica problem and you need some help, let me know. Click the link in the comments. Thanks, everyone. Chat soon.